A record of 39.6% of students cracked the Foreign Medical Graduate December 22 examination. Hello foreign medical students, welcome to my YouTube channel. A high pass percentage of 39.6% have been achieved by the foreign medical graduates in the December 2022 examination. A media report from the Times of India in Education Times reveals this data. Record 39.6% of students cracked the Fmge December 22 examination. Most foreign medical graduates worked hard to crack the foreign medical graduate examination to avoid the national exit test examination. This is the pass percentage. Two 2022 39.6%, 21 23.91%, 20 9.94%, 19 20.7%, 18 10.2%, 17 7.41%, 16 11.22%, 15 10.40% in June, 12.20 December, 14 4.93% June, 20% December. This is the pass percentage taken since 2014. On the condition of anonymity, an official from the Union Health Ministry says students have worked hard and the difficulty index may also have been slightly lower this time. A high pass percentage is an aberration rather than the norm. Students have made the last-ditch effort to clear the Fmge. Usually, Fmges from Nepal, Bangladesh and Maldives are able to do well because their syllabus is quite similar to that of the Indian medical education system. Most Fmges have to spend at least a year learning a foreign language, and the MBBS course is often more theoretical as the patient connectivity is less, and the Fmge does not test the practical training of students. Testing practical component may further reduce the pass percentage. The national exit test will have a practical component, not just Fmges. Even the quality of training among Indian students in private colleges will be tested for the first time. It will help reveal the medical colleges rankings automatically, and people will not go to colleges where the maximum number of students fail. Online and offline support. Last year in June, the pass percentage was low, so the students worked harder to ensure that they are able to clear the examination. All students cannot travel to metro cities to prepare at good coaching centers, so many took online subscriptions of apps to prepare for Fmge. Some students had the support of both online and offline coaching classes, and that made a lot of difference to the pass percentage, says a faculty surgery preparatory ladder, pointing out that 30% of those who pursued medical education in Ukraine appeared in the Fmge, and among them, one-third were able to clear it. Most students who scored well began their Fmge preparation from the first year of MBBS itself and spent 4 to 6 hours every day preparing for the examination. Students are now more aware of what to study and where to study. The difficulty level of the examination was the same as NEET PG, and despite clinical questions being asked, foreign medical graduates were able to do well. Students were afraid if they do not clear it this time, they will have to appear in national exit test later, with which they are unfamiliar. They have pushed themselves to clear Fmge in one go. This year's pass percentage is the best, says Singh, adding that students who pursued MBBS in the neighboring countries such as Bangladesh, Kyrgyzstan, and Tajikistan have also performed well this time. The lockdowns during the COVID pandemic provided much needed downtime to students to prepare for Fmge. I was rescued by the Vande Bharat mission that facilitated the travel of passengers to India during the pandemic. In January 21, I went back to complete my MBBS. Fmges are discriminated against in India, so I wanted to prove a point that the Fmges are also as good, if not better, than the Indian medical graduates, says a student who started preparing for Fmge in 19 and completed his MBBS from Asian Medical College in Kyrgyzstan in 22. Hailing from Salem, Tamil Nadu, he attributes the high pass percentage in December 22 Fmge cycle to the downtime due to the pandemic and high awareness about the online platforms such as PrepLadder that help in the preparation. Dr. Sassim scored 238 out of 300 by practicing previous year's questions and participating in group discussions on difficult topics. Thanks for watching. For updates, subscribe to my YouTube channel. Thank you.